If you suffer from chronic pain, you might be considering surgery, but our next guest says other options may be better for you. Dr. Rainer Kramer from AZ Pain Centers is here now to tell us all about those options. Good to see you.
Good morning.
So what do you guys do that's different to treat the pain?
We have a great team of very skilled and trained physicians who've had decades of experience. We focus on discovering the source of pain and then using treatment options that work synergistically with the body to help that body heal its tissue non-surgically and using minimally invasive techniques.
Right, it's a term that we hear. It's called regenerative, right? Regenerative therapy.
Right. Patients have a variety of conditions that we treat, from spine pain to knee and joint and hip pain, and they're offered the traditional approach, which is a surgical option. We focus on seeing if the patient is really a candidate for a non-surgical approach. Regenerative therapies use blood-based therapies, stem cells, platelet lysate, superconcentrated platelets to help cartilage grow and heal. We assess the patient very thoroughly to see if they're a candidate. Not all patients that come in our office are a non-surgical candidate, but we'll let folks know that if they can be helped by what we do, we will let them know what their candidacy is and help them on their journey for recovery and functional gain.
So how do you go about diagnosing the pain?
Well, that's a great question. First, you take a history, a physical examination, diagnostic imaging. It's all got to fit to see if they really match as a patient for the therapy that we do. But we try to be very intentional, very meticulous, and very detailed to find out what the pain generator is.
And I like what you said. Not everybody's a good candidate for this.
No,
and you
absolutely.
will tell them that, correct?
Absolutely.
Okay.
Because if they need a surgical procedure, they need a surgical procedure. But if they're a candidate for what we have to offer, we will discuss that and help that patient make an informed decision in their journey for recovery and functional gain.
So what are some of the new options that you guys offer at AZ Pain Centers?
Well, we have our traditional, which is our non-steroidal treatments, our low-dose steroids, but with some of the great things that we have to offer are regenerative procedures using stem cells, platelet lysate, and superconcentrated platelets. Helps the cartilage heal, helps the joints heal, gets the patient into a recovery mode and functional gain.
And for so many people who are living in chronic pain each and every day, when they come see you, they're probably at their wits' end.
Well, they are, and they're also afraid of having a total knee or a total hip done or a total shoulder because there are side effects to more invasive procedures. And you have to assess the risk-benefit of that. And we help them in their journey in making, again, an informed decision.
And I understand that you guys have a tool on azpaincenters.com on your website. How does that tool work?
Well, that's an we live in a world where insurance carriers are directing more financial burden to the consumer. This creates transparency to allow the consumer to make an informed decision with regard to their finances. Regenerative procedures cost less and they can be much more effective than a very complicated surgical procedure.
Right, and for people who have to go through the surgery, when you add up what they are losing in pay, if they're away from work, what they're spending, and then you've got physical therapy.
Right, when you're looking at downtime, surgery has greater downtime, greater cost. When you're looking at a regenerative procedure, there's less downtime and less cost, quicker return to function. We believe we have a very viable and very research-based option for patients to consider that are looking at an invasive knee or hip or shoulder procedure.
All right, let's give you some information now. If you would like to stop living in pain, we encourage you to go to the website for that calculator and that tool, azpaincenters.com, or you can give them a call. The number is right there on your screen, 480-821-PAIN. That is the number to book your appointment. AZ Pain Centers accepts most insurance plans, and they have locations statewide. For Tucson, call 520-742-PAIN, or you can also call 844-REGENIX. That's 844-734-3639.